Hey, Cynthia Tieche here with Dr. Tieche. So we have something really cool that we've started doing here. We want to tell you guys about it. It's been out for a few years, I'm pretty sure, but kind of new to Ocala. I don't really know anyone else that's doing it yet, but it's exciting. So some people refer to this as Microtox facials or Botox facials. So let's talk about what is a Botox facial. And what's the difference between getting the Botox facial and getting actual Botox?
Okay. So microneedling has been around for a while, and we know the science behind microneedling. That's where we make tiny punctures in the dermis of your skin to help stimulate the capillaries and stuff underneath the skin to bring in growth and healing factors, to bring in collagen and help repair tissue. We know that it gives a much smoother look on your face. It helps clean out acne scars. It helps shrink pore size and generally just give you a glow to your skin. So with that, people have been doing all sorts of things with that. We started out putting hyaluronic acid on it, and then of course we started putting PRP on it. So we had the PRP facials, which are amazing, and stem cells, which are all amazing for help stimulating that skin, stimulating the collagen, and stimulating the blood vessels and everything underneath. Well, now we've taken it one step further. We're adding other nutrients and stuff into it and other products. So one of the things that we're putting in there is Botox, which is, as we know, a neuromodulator, and it has been used in a different form on our face. It's been used to treat wrinkles and fine lines. And so that's when it's injected into the muscle in a little bit higher doses. When we add it into the microneedling device, it goes into the tissue there, but not into the muscle, but just into the dermis in very minute doses, and actually helps make some transformations there. It helps shrink down the oil glands and decrease oil production. It definitely helps shrink down pore size, and so it helps with a lot of that stuff. Its dose is very small, so that you can repeat these treatments really every 4 to 6 weeks with safety, without having any weakness or paralysis or drooping. And we're just using that to add into the benefits of all of the other microneedling. We have other substances that we're adding into it. We're adding vitamins in there. We're adding different things like glutathione and lipoic acid in there, which are all, we know, are great for the skin. And so we'll be able to now, with some of these newer devices, be able to deliver that right into the skin, and with a newer microneedling device.
So traditional microneedling is putting the topical solution on whatever it is that you're using and microneedling it in. But we've got this new device that we're going to be using, and it's got 24 karat gold plated needles on it that are smaller than your hair. So most of the time people are not getting numb for this procedure. We're going to put some numbing just to make sure you don't feel anything. But we have this little mesotherapy type bottle here. So the solution would go in here, and then when you take the cap off, you stamp it onto the skin, and out on the side of these needles is that's where all this stuff is being delivered into the dermis. So what an amazing way to get this stuff in, instead of just traditionally putting it on and microneedling in.
Yeah, so the big difference is two ways: having the chamber to be able to administer it, but secondly, the design of the needles. So in traditional microneedling or dermal rollering or any of those things where we're just stimulating the collagen and making the punctures, it's just a hole goes in, out, in, out. And so this stuff kind of oozes into those holes and we drive it in. These needles are specially designed so they have little holes on the side that are little chambers. So as it comes back up into this reservoir, it grabs some of that solution, and then when it does the microneedling, deposits, grabs it and deposits, grabs it and deposits. So it's actually impregnating in that tissue into the dermis, impregnating that substance into the dermis at every level. And so it's a whole different way of doing it. It's having amazing results because of that.
Yes, I'm so excited about this. So really cool, different things it'll help with. So we use the Botox because it's helping with the oil production and all those fine lines and that crepey skin right around here, which, good gosh, I mean, who doesn't need help with that?
And so that's always been, let me just interrupt that. That's been a new thing that people have struggled with a long time, called microtox, and basically trying to administer those neuromodulators into here to get rid of these fine lines and wrinkles, because the dilemma is when you try and use a needle and put it in there, you deliver too much. or you can bruise. And so the tissue there is too thin, too delicate for that. So this is another way of delivering it into that thing in small doses without causing that bruising or the tissue disruption, as opposed to using a needle and getting the same results.
Yes, it's awesome. So then also, this is great for lightening and brightening because we use different combinations of vitamins that are geared towards skin health and
like
glutathione, biotin. I mean, putting these things
Vitamin
directly
C.
into the skin, amazing. We can really treat inflammation and acne with this because there's some vitamins that are very, very good just for that specifically. We're going to have a combination for hair loss. We do a lot of PRP and stem cells right now with microneedling for hair loss, and which now we can use this device, which we think will be even better to inject.
Well, back to another thing with acne, it's been known that we've been doing this for a while, is injecting cystic acne, which is the big acne, which is really much more inflammatory related than just, not washing your face teen acne. And so it's always very difficult to treat with either topical solutions, tretinoin, and all these clindamycin and all kinds of stuff that we've used, benzoyl peroxide and salicylic acid. It's been difficult to treat, really, at best. And so we know that injecting microscopic amounts of steroid into those things causes them to go away completely. And so we had to use a needle to do that. This is yet another way of doing that. So we can kind of treat larger areas with this by stamping it in, backs, shoulders, people who have acne from maybe hormonal acne. And this is going to be a way of treating it very quickly and easily to help get rid of that.
Yeah, that's pretty exciting. I'm loving this little thing. So then, yes, we'll do the hair loss one, and then anyone who's got those fine lines like we talked about right around here. So we'll have different combinations for each person. Another thing is people putting hyaluronic acid in this and injecting it right into the dermis. What would be the difference between using a hyaluronic acid filler injection? What's the difference between that and this, injecting it into the dermis?
Well, it's just the layers, so we have lots of layers in our skin. We have the dermis, which is the outer layer, and that layer gets thin and loses some of its substance and collagen. Then below that, we lose our fat and stuff, and that's what causes the outer layer to kind of sag because of loss of volume underneath. So it's a multiple layer thing. So if we want to make it look good from inside out, we have to treat every layer. We can't just do one. It's just like washing the outside of your car and saying the inside is going to be clean. It's not. We have to do them all. Yes, it would be nice if one thing fixed everything, but it's just not there. So we have to treat each layer, and that's the advantage of these things is now that we can go deep, middle, and then right to the skin level and apply these products that are going to help stimulate collagen, help increase growth of that substance that's in there, with basically the substance that we have in there when we're young, and that's really what we're trying to stimulate again.
So this is not replacing traditional Botox treatments. It's not replacing traditional filler injections. It's a new addition that now we can treat that outside the skin better than what we were before with this new device that we can inject, and using Botox to inject and those hyaluronic acids to inject right into that skin to make that skin healthier too and more plump. Plump in a good way.
Oh yeah. So it's not plump fat. Plump just add that thickness that we want, because that's what everyone wants.
Is
when you see young kids that have those nice cheeks, it's not just that their cheeks are large, but their skin has that great tone to it, and that's what we're trying to do. And this is a great device, and we're glad to be able to offer it and offer all of these lots of things with it. But you're right, it will not replace Botox. It will not replace traditional neuromodulators, because we're going at a totally different level. And same thing with fillers, totally different level, trying to accomplish something different, but they all work great.
Yes, so we are now offering this at Recharge Clinic. The prices really vary. They vary because it just depends on what you're getting, Botox or fillers or whatever you're getting put in there. So call for your free consultation and we can lead you into the right direction and get you started looking youthful again.